My name's Juliet Ashton. I'm the new National Sapphire Nurse Consultant for Epilepsy Commissioning. I feel really privileged that this is the first role of its kind across neurology, and it's been brought about by the commitment and passion of the voluntary sector, Epilepsy Society and Epilepsy Action, working with neurological commissioning support. So in my work, I'm going to be focusing on identified local areas to improve outcomes and quality of services for people with epilepsy. My aim is to gather as much information as possible on best practice from around the country and use that in the local areas that I'm going to be working in. So that will include service redesign, developing models and tools to improve commissioning of these services, and then in turn using those findings and recommendations across the country. I'm really looking forward to working with service users and health and social care professionals to understand the provision and perspective of local epilepsy services. And then what I want to do is establish good practice in those areas, which is really important, but also look at gaps in service provision and see where we can improve on those. So, for example, if people don't have access to an epilepsy specialist nurse, then that can lead to an increase in inappropriate admissions, which in turn leads to an increase in cost and poor outcomes for people with epilepsy. So I'm really looking forward to actually doing an overview of these services and seeing where we can make those improvements.